Hi YouTube! So I know it's been a while since I have done an update and I think I left off after pediatrics, and so I need to talk about my internal medicine rotation, which was a little while ago, so I apologize. But I have all the books. My husband John, he's on the rotation right now, so I finally have all the books together that I wanted to show you that I used during my rotation, so I can tell you all about it. So for my internal med rotation, I was able to stay kind of here at our home base, which was nice. You get to come home every night and sleep in your own bed. And it was a quick rotation. I don't know if it was just because we were busy every day or what, but it flew by. And I don't know, it was really an interesting rotation just because I was paired up with a hospitalist and didn't do any clinic or anything like that. It was like we lived at the hospital pretty much. And so, depending on your situation and who your preceptor is, it could differ from student to student. I know some have done only clinic, some have done a mixture of clinic and hospital, and for me, mine was pretty much hospital only. Actually, it was hospital only. And I hadn't had any great real experience with hospitals. I had done a lot of clinic type things. ER was in the ER, and neurology, I was in an outpatient clinic. And let's see, pediatrics, I was in I guess, yeah, pediatrics is pretty much in an outpatient clinic. And then surgery, I guess, was hospital, but we did a lot of clinic and same day things, so we didn't have very many patients actually in the hospital. So I was looking forward to it and also a little bit nervous just because I was worried that, I don't know, it would be somehow intimidating to be in the hospital and working with kind of more sick patients. But I don't know, I ended up really liking it. It's not what I want to do, but it was fun to work up some more complicated cases, or I don't know, just kind of see the whole result of that. And the hospital I was at was, I think, the largest that I had been at. Well, like I said, I didn't do much hospital work, but it was a fairly large hospital compared to what I'm used to, but it was pretty small still. It was kind of in the suburbs and really nice. Kind of, actually, it was like new, so I almost felt like me walking in almost feels like a spa, and it's kind of ridiculous in that sense, but it was really nice. And the patients have like flat screen TVs and nice, light fixtures and everything. It's very calming and, like I said, kind of like a hotel experience. But anyways, on my rotation, there was one doctor and a PA my very first week. And the doctor I was with actually was a local tenum, so he was kind of filling in for spots all over the country. So he was, leaving the state after I was with him and going somewhere else. So that was really interesting. I actually showed up my first day and kind of checked in at the nurse's station. They said, "Oh yeah, you're with Dr. So-and-so, he's over here." And I go over there and he's like, and the nurse had said something and he's like, "Oh, I have a medical student." I was like, great, this is going to be awesome. He wasn't even expecting me, but like I said, he had just kind of come in to fill in for somebody, and actually turned out great. He was wonderful. He was only maybe a year or two out of residency, and so it was helpful because he was able to kind of teach me the things, tricks and things from residency, and that was fun. So where I was at, the hospitalists were on for 7 days and off for 7 days, on for 7 days, off for 7 days. And so I actually ended up, my 4 weeks, I was with 3 different physicians. My first week, like I said, I was with the local tenum, and then I was with another doctor the second week, a different doctor my third week, and then the same doctor as I had on the second week for the fourth week, if that's not confusing. Which was fine. It's nice to have the same doctor for 4 weeks, but oh well. You get to kind of learn a little bit different things from different doctors, so. Let's see. And there wasn't any residency programs. There wasn't any residents there. I don't think I saw another med student there. And for the 2 floors in the hospital, there was just, the first week I was there was just that hospitalist and a PA. And oh my gosh, they were busy. I think that first day I showed up, he had to see like 30 patients on his own and check in on them or do some new admits. So that's, after looking back and seeing how many other hospitalists see, that's a lot. And so kind of first day I kind of bumbled around with him, seeing patients and working up stuff. But then by the second day, they kind of figured out a good idea that I would get any of the new admits and I'd get to do the H&P and see them first and kind of present to the doctor, and the doctor would go in and do that. And then, so let's say then the next day, so if Monday I came in, I had new patients, I did the new admits, let's say there was 3 new admits that day. And then on Tuesday morning, I would show up and do kind of my own rounding on my 3 admit patients, see how they were doing, and then I would meet up with the doctor and present to them, and we go back in and see those patients, and then any new admits I would see on top of that. So I was responsible from anywhere from like 2 to 6 patients a day, which really wasn't bad compared to like the 20 or 30 that my doctor was seeing. So I was kind of disappointed. Sometimes when you watch the TV shows, you see like you wake up early in the morning, like 4 a.m., and you go round on your patients at 5 before the residents do, and then the residents come and then the attendings do round with them. Really wasn't like that. The doctor just kind of rounded on his patients throughout the day. So if he had 20 patients to see, he saw them sometime between 7 a.m. and pretty much 5 p.m. He was pretty much done by. And so same with my few patients, which was nice because I could tell they were super busy, so I kind of gave them space, but it gave me time to work up my own patients. And then when we'd sit together and talk about it, I did a lot of learning from them. And then I also had time to read throughout the day as well, which was nice. Can't complain about that. And so yeah, it was kind of laid back. I think quite a few of the docs say. Some of them I was there, they wanted me there by like 7:30 or by 8 or something, they would tell me. The other doc said, okay, well, you have X amount of patients, just come find me at 10, and by then you'll have seen all your patients. So that kind of gave me the freedom, like, oh, if I have 6 patients to see, I should be there maybe by 7, or if I only had 2 patients, I could come in at like 8:39. So that was nice. And they always sent me home at about 5:30. They never let me stay past 6. There really wasn't much to do after that. Let's see. Hospital patients I saw were kind of the typical things you'd expect to see. A lot of COPD exacerbations, pancreatitis, congestive heart failure, cellulitis, a lot of like chest pain rule outs we would see. And then we also rounded on some of the ortho. So if someone's getting their knee replaced or something, they'd always consult the hospitalist for like their diabetic care. So sometimes we would just see patients for that, and I helped out with that when I had some time. Yeah, so just kind of, I don't think there was any huge cases. I think I saw a DKA patient as well. Some we saw in the ICU, which was exciting. There was an, what do you call it, intensivist, which I didn't even know existed. That was around there too, but it was nice. Like I said, I was the only medical student, so if something interesting or something a doc wanted to show me, would pull me aside and kind of teach me whatever they thought I needed to learn. Just like if a cardiologist was in the hall, oh, there's one that stands out, and he was pretty funny. He's like, hey, you, because I was wearing my little short white coat, so you could tell I was a med student. He's like, you look like you need to learn some EKGs, and so he pulls up the EKG, and so we read through that. So that was really nice. The nurses and everyone was really nice. Great time there. What I really liked about my rotation is, yes, I could have been with the doctor and followed him on all 25 of their patients and, seen them doom. But it was nice to have my few that I focused on and really read up about and really worked on treatment plans. And I would get there in the morning and I had access to the computer so I could write in all their labs and all that and their vitals. And I don't know, I had the time to really kind of work them up and really think through it. And that was really fun. The other part of that I really liked is that some patients we had to have consults on. We had one patient who had quite a few consults between like urology and pulmonology and some other things, some oncology, hem-onc as well. I got to sit outside. I tried to position myself at a little station near their room, and so I would wait for the consult to show up, so the pulmonologist to come in, and we talked through things. And he stands out in my mind because he'd let me go in and see the patient, and then he would show me like the CT scan and what he's looking for, and maybe what procedures they need to do from here on out, and that was really great. I loved that, and actually the patients really loved it. What I liked about it too is that I was the kind of the glue that was holding everyone together. I was the face that they saw. So even if they were there over the weekend, even though they'd have a new hospitalist, I, the med student, was kind of their person that was the same throughout their stay. And then anytime a consult was there, I usually was there too. And so I was really helpful. Instead of the consult just reading the notes, I could stand there and I could fill them in on what's going on. And it was really good. I think every patient needs just a med student, because anytime there's lots of different care and different plan things going on, communication can kind of get all screwed up. And so I got to be kind of the center for that and be like, oh, we already ordered that, or oh yeah, we talked to them and they were referring to these people, and it was really, really nice, and the family really appreciated it. So I try to do that on any of my patients I saw that had kind of a lot more of a workup, and you know, because you see your quote-unquote easy cases of just like pneumonia that the hospitalists handled on their own, or I guess even CHFs, and we had the cardiologists usually would round on their own patients too. So sometimes they were even involved, but then the cases that had 3 or 4 different specialties involved, it was really interesting, and I learned a ton. So that was pretty much my internal med rotation. It wasn't anything too thrilling, nothing like emergency medicine. I think I drove them crazy because I think my most exciting procedure I did was a rectal exam and a guaiac, a stool sample check for guaiac. And so, I mean, anytime there was like, a thoracentesis or something, they always had a team that needed to do that. They didn't get to do it, so I was kind of bummed. So that's why I don't think I could be a hospitalist, because I like to do all the procedures. Another thing is you don't really get to do the follow-up. You say follow-up with your primary care doc, and I don't know, I was like, well, come back and see me, because I just worked through this whole thing with you, and now I'm sending you off into who knows. And the same thing when they come in, you're taking their history, and it would be so nice if you were their doctor. So there were a few patients who I knew like they had their own doctors come in and round on them, and that's what I would do if I was internal med. But I understand the hospitalist is really nice for the hospital, and also as the physician, you work 7 to 7 days a week, or whatever that is. And that is nice, but it has its drawbacks too, I can tell from the patient side. But yeah, I'll show you kind of my study schedule that I used. I just wrote it up for John. So I kind of have it here. But our school had a syllabus of these are important things you need to read. This was the book that they had recommended. And so I bought that. And then I've really had good luck with the blueprints books. So I had the medicine book of that. Again, my case files, which I love. And then I also bought, again, this is too many books, but I also bought this book. So the books I did use, since this was in the syllabus and there's different chapters we had to read, I knew I had to do these. And then I also for sure wanted to get through this. And so I made a little study schedule of each day. So I kind of paired up each day. So let's say I started on a Monday. I had Monday and Tuesday would be like my cardio day. And so on the Monday, I would read the cardio chapters out of here. And then on that Tuesday, I would read the cardio section in here, and then do 50 questions on ComBank or whatever question bank you have. I just did 50 questions a day. I usually do them all random and everything, but I really wanted to focus in on what I was studying and review that material. So I would do 50 cardio questions. And then that's Monday, Tuesday, and then like Wednesday was endocrine. So again, I read the endocrine chapters out of here, the endocrine chapters out of here, and then did the 50 questions. So that was Wednesday and Thursday, and then so on. And so then by the last week, I was pretty much done with that with 1 week to spare. This one has some questions in the back, and also this one has questions in the back, so I did those that last week and reviewed all that. And then I also used we have access to the, I should look this up, it's like MSKAP or something book, and it's just a ton of questions, and we have access online through our school for that. So I used some of those. I thought it was easier to use the question bank, to be honest, just because it was on my computer, and it was just pretty easy. I didn't really use this as much. I wanted to, but I just didn't have enough time. And then this is what I used if I needed extra I don't know, information on something, I would look this up. I did not read this cover to cover by any means. I just used it as kind of a reference book. And then, of course, anytime I was working up a patient, we have access to Harrison's, and I still have Tintinelli, which I know is still an ER book, but I like to see the whole picture of things. So if someone came in with pancreatitis, I like to review what their symptoms on onset was, and then I would look at Harrison's and look at, the different treatments, and then kind of recovery and all that. So and then I used Up to Date all the time. So that's what I did on my patients that I saw. I kind of did my case by case. I used those references, and then this was to study for the exam, which I took that last Friday, and it went really well. I thought it was actually the worst test, just because it kind of felt like step 1 or level 1 boards all over again, where it felt like everything, just a grab bag. I'll be honest, I didn't think it focused on a lot of the things that I had seen in the hospital, a lot of like nitpicky little things that I had not seen on my rotation, so I'm so glad that I did supplement my patients that I saw with all this reading, because I know I would not have done well on the test if I didn't do all the reading that I had. And yeah, I did really well. It's my best test to date. I ended up, I think, 2 standard deviations above the mean, so yay, I did well on that one. Anyways, that is my internal medicine rotation. If you have any questions, just let me know.